Hello, welcome again to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Cardiology. I'm Dr. Seth Pellizzari, a cardiologist with Pentucket Medical here in Haverhill, and I'm here with my associate, Dr. Sunny Srivastava, who's become on our program our resident expert in lifestyle strategies for reduction of cardiovascular events. Dr. Srivastava has a real expertise and interest in talking about diet, exercise strategies, and today he wants to bring to us a recent article that was presented in U.S. News and World Report on a rating of best diets. Diets obviously are a critical thing for us in America. We have a lot of access to calories, easy to access calories, drive-throughs are available on every block. And Dr. Sunny is going to give us some insights on strategies and different ratings, how these diets were rated. And my thinking about this as a cardiologist is that every diet is not perfect for every patient, and to some extent some tailoring is, so I'm going to listen with great interest on what he has to share with us and some ways about thinking about this for our patients.
Great, well thank you. So just as you said, U.S. News and World Report at year's end published a analysis of or a ranking of the top 29 diets. I'm not sure why 29, not 30, but the top 29 diets. And it got a lot of press. It was all the major news outlets covered it. And to be rated, these diets had to be relatively easy to follow, not too onerous, nutritious, safe, effective for weight loss, and also effective against diabetes or cardiovascular disease, and not overly costly. So that's sort of what got you into the pool to be rated. And then they rated all these diets based on that scoring system. And the diet that came out on top as the #1 ranked diet of 2012 was the DASH diet. Yeah, a little drum roll.
Yes, okay.
The DASH diet, which we've actually talked about before on this show in other contexts as a relatively healthy diet. It has largely been viewed as a diet that's effective at preventing or treating high blood pressure. That's where it gets most of its most thought of in that regard. But it can also be a good diet for weight loss as well. And so they claim, the proponents of the DASH diet, that a healthy eating pattern is key or essential to decreasing high blood pressure, and you could actually lose weight if you do it properly and cut back on the caloric intake. And the theory is that a lot of nutrients that you get in the balanced diet that they propose, such as potassium, protein, fiber, they're crucial for fending off or fighting high blood pressure. You don't necessarily have to track each individual macro or micronutrient, but you really just got to emphasize, and it's not rocket science, the good foods, so fruits, vegetables, whole grains, lean proteins, good sensible low-fat dairy, and avoid the stuff that we've all, I think, grown to crave sometimes, the calorie-laden, fat-laden, sugar-laden foods, red meat, but they also add in the component of cutting back on salt. And I think we're learning more and more that in our society we consume much too much salt, or sodium as people refer to it as salt, and it's really taking its toll on us. We're going to talk about the numbers and talk about things in that regard, but it's really taking its toll on our blood pressure and other issues as well. And so what do people do? First, you got to learn a little bit about what the diet is, and there's lots of literature out there, some of it short and brief and some of it very long and voluminous that one could dive into to read to learn about the diet. And it takes you through the process of determining how many calories you need on a daily basis based on your age, your activity level, and then it walks you through where those calories should come from, and always throws in the reminder to go easy on the salt. And we're going to drill this down a little bit more. And you can tailor what your if you are requiring a certain amount of caloric intake per day, factor in a calorie deficit, and that's how you lose weight. You cut the calories down. If your base requirement is, let's say, 2,000 calories per day, cut it down to 1,700 or 1,500, and that's how you lead to weight loss, certainly.
Let's just, for our audience, make sure that everyone knows what calories are. Like, people hear the term. Help us understand what calories are.
Yeah, it's sort of a way of measuring how much energy your body's going to take in from the food. And energy essentially can get converted to fat if you're not using it up, basically. I mean, that's a simple way of defining it. And so this diet, without a doubt, the DASH diet, likely will lead to weight loss if you factor in this caloric deficit that I was just referring to. It's really been shown, though, numerous studies to reduce high blood pressure. It also can increase your good cholesterol. That's called HDL. And it decreases your bad cholesterol, the LDL. It can decrease another type of fat in the bloodstream called triglycerides. And so overall, the DASH diet does reflect what the medical community has come to think of as a healthy diet promoting a heart-healthy lifestyle. There are some studies to show that it may prevent diabetes, but not quite as robust with its data as far as the high blood pressure field is. And then some other questions that this article really addressed was, how do these diets address the government's daily recommended allowances for different nutrients and such? And the DASH diet does pretty good. It keeps you on the low end of what your daily consumption of fat should be. You get the acceptable amount of protein and carbohydrates. And salt is where this is really a winner. That the recommended daily salt intake is about 23 to 2,500 milligrams of sodium. However, if you're over the age of 50, if you're African American, if you have high blood pressure or diabetes or chronic kidney disease, they actually really tighten that up and recommend 1,500 milligrams. And you got to get really good at reading labels, because 1,500 milligrams or 1.5 grams is a challenge to achieve if you're eating typical American diet in the grocery store or restaurants. It's really tough to achieve that. You got to really pay close attention. The DASH diet really gets you there very much. That's the crux of the diet. Other nutrients like fiber, no problem. You get the right amount of fiber. And potassium is one where, for whatever, this U.S. News and World Report really started to focus on potassium quite a bit and really view potassium as a key nutrient in countering salt's ability to raise blood pressure. Decreases bone loss, reduces the risk of developing kidney stones, and the daily recommended amount of potassium is about 4,700 milligrams. That's tough to get. People always say, oh, I eat a banana that's rich in potassium. It actually takes 11 bananas to get to that number of 4,700 milligrams. So it's not the easiest thing to get to. It is present in lots of fruits and vegetables, and so if you push your diet more towards the fruits and vegetables, as many of these diets want you to do, you can get there. So this is one of the few diets that really does get you there with the right potassium. Calcium usually can do pretty good, and same for vitamin B12 and vitamin D, two other nutrients that are talked about quite a bit in this article.
So your number one diet that you say from this article is the DASH diet. Mm-hmm. So if patients hear you and want to learn more about it, just tell us what resources might they try to track down. And the other question I'd love you to just extrapolate on is, you said try to figure out how much calories you should need or what calorie goal. Mm-hmm. Can you help give our audience some insights about how they can get those two pieces of information?
So if you have access to a computer, it's probably the easiest way, and you can Google, type in there daily caloric needs or calorie calculator, and it's a very simple equation based on your age and activity level. Something can get a little fancier, and it'll just spit out a number at the end of what your...
So you put in your age, or your gender, your sex, male or female. Then you put in, I exercise not at all, a little bit or a lot.
Yeah.
You put in, might even have something like, what is your work, like if you do a labor job or
some of these are definitely more, drill it down a little bit more. That's probably better to do those.
Right, and it sort of figures out that based on those average calculations, you're burning so many calories, say 1,500 or 1,800 calories. And then if that's the number, if you keep eating that much, you'll stay the same.
Stay the same.
But if you eat less than that, you'll be like spending down your bank account, so you'll be losing your bank account. And the bank account, of course, is our bellies here.
And so that's what they took the phrase, caloric deficit. So just what you said, if you come out with this calculation that you need 1,900 a day just to status quo, then it's not too difficult to figure out.
You keep putting 1,900 in your mouth, you keep exercising 1,900, you're going to be exactly the same.
Yes.
Okay, so that's helpful for us to understand that.
So then you can pick a 1,500 and you're gonna lose weight.
Right.
No doubt, there's just no way around it.
Without changing any exercise. And of course, if you increased your exercise, you would lose
even
more.
Okay.
Yeah.
And the tricky thing is to really learn how to read labels and know. It's not as easy as it may seem sometimes. I think people are dining out, people are doing it, so it can get tricky certainly.
Yeah, life is complicated.
Yes, that is true.
So that's that. And then the second question I asked was like, just say, okay, I heard the show and I'm believing the DASH diet's number one. Let me go for it. I want to improve cardiovascular health. Where would I go for that?
Yeah. So again, the computer is it's a phenomenal resource, and you can, same thing, Google DASH diet, and there's going to be loads of websites with guides on and recipes, and really walk you through the whole thing. There's books. You can go to the bookstore or go to Amazon.com and buy books that are the DASH diet with a whole glossary full of recipes galore. They will walk you through this. I'm not going into the real nitty-gritty science, but
Right.
you can read through all that as well. And so one thing is, what about the cost of this diet? That's another important thing. And it could be a little bit more costly than what you might be doing right now, because it does put an emphasis on fresh fruits and vegetables and whole grains. And depending on what your shopping patterns are right now, if you're eating more processed foods, it can get a little more expensive. But there's no membership to any club. There's no buying pre-made foods from a company, nothing like that with the DASH diet. So you can tailor it to what you want to do and need. And so the cost might go up a touch, but it's not, I don't think, a prohibitively expensive diet.
So I have patients that often tell me in the office, look, I eat well, but I know I just eat too much. That's what I hear frequently. Now, obviously, I don't know if that's what's true, but that's what they will tell me. So if a patient says that I'm not eating a lot of processed foods, I don't eat frozen foods or foods that are sort of already made, but cook at home and use primarily fresh fruits and vegetables and not a lot of meat, what I'm hearing you say is, I guess the biggest change that most people will experience will be really the salt part of this diet. Is that fair to say if you're in that category?
And, I think we probably eat more meat in our society than what I think a lot of these diets are pushing, and certainly pushing leaner and smaller cuts of meat, and more fish, more seafood, more lean meats, much less in the way of red meat. I think a lot of people will eat red meat several days per week, for example, and that's definitely not the case with any of these diets that we're talking about, really pushing away from that. And then the quantity of meat. You go out now and you order a burger, and it's a gigantic 8-ounce, half a pound burger, which if you go back into the 1950s and 60s, that was a 4-ounce patty, and it's just gotten bigger and bigger and bigger over the years. And the bun is gigantic, and it's mind-boggling how much is there.
Okay. All right, great.
So I think that's a big part of it, sure.
Okay, so let's move on. So you give us a good summary of the DASH diet. What comes in at number 2? What's the
All right, so
runner-up?
number 2 was a diet referred to as the TLC diet, which I'll have to be honest with you, I didn't know a whole lot about it. It stands for Therapeutic Lifestyle Changes. And this diet is really geared towards cutting your cholesterol. And they claim in this diet, in 6 weeks, you will lower your LDL cholesterol, that's your bad cholesterol, by 8 to 10%, which is pretty good for 6-week dietary changes. And it has a lot of science behind it. It was created by the National Institute of Health's, their National Cholesterol Education Program, which is a very well thought of entity and produces a lot of research in the area. And the American Heart Association endorses it. And what they really focus in on is cutting back sharply on fat, and particularly saturated fat. And saturated fat, you can think of dairy, fried foods, fatty meats. Those are sort of the saturated fat crowd. And it also wants you to limit daily dietary cholesterol as well. And those two things, combined with some increased fiber in your diet, can really help manage people's cholesterol. So that's what they claim, or that's the theory. And so the way you do it, and the way they go about doing it's the same thing. You start off by choosing your target calorie level. So same thing we just talked about, going to one of the computers and figuring out what your daily caloric needs are. And if you're only concerned about lowering your cholesterol, weight loss isn't your goal, they just fall back on picking 2,500 for men, 1,800 for women. If you're looking to shed some weight, then you lower that. And what they picked as theirs was 1,600 for men, 1,200 for women. Anyway, you in that context then cut saturated fat to less than 7% of your daily calories, which means eating less of the high-fat dairy, ditching fatty meats. You consume no more than 200 milligrams of dietary cholesterol a day. And they gave the example, that's what's in about 2 ounces of cheese. So I guess 2 ounces, you think that would be a slice of cheese on a sandwich? Is that about 2 ounces, would you say?
So.
Sounds about right, okay. So, and they propose or state that after 6 weeks, you will have dropped 8 to 10% in your LDL cholesterol. And they go on to do other things. If you're not quite there, you can add some other things and do some other things. But that's their claim. Just get rid of fat, cut it down to really low. There's another diet called the Ornish diet that got a lot of press years and years ago, very similar. Pretty tight control of fat. 7% or less is pretty aggressive for saturated fat. And whether or not you lose weight on this diet was really more geared towards cutting cholesterol. But if you factor in a lower caloric intake, then sure, you're going to lose weight as well. And they feel that, yes, there are cardiovascular benefits. It is very similar to the commonly accepted view of what a heart-healthy diet is. There's no great studies on that quite yet. Now, as far as diabetes go, there are some studies to show that this diet will lead to lower insulin levels. And that doesn't necessarily mean less diabetes, but it's thought that higher insulin levels over time can lead to a higher likelihood of developing diabetes. So that's also viewed as a pretty good diet for that regard as well. There's certainly no known health risks to this diet, just like the first diet we talked about. That's another question. They looked at safety with all these diets. And this really, for the most part, with all those nutrients we were talking about, fat, protein, carbohydrates, fiber, potassium, et cetera, pretty much keeps you in track to get your daily recommended allowances for all these things. A lot of it's up to you when you're picking fruits and vegetables, what you're picking to meet some of these requirements, but for the most part, you can get there with most of this stuff. And certainly with all these, exercise is also very much recommended to go along with all of them.
So the difference, give us a short summary of the difference between DASH, the #1 diet, and a TLC diet that you recommend, that you just discussed, another #2 diet. It sounds to me like both of them emphasize really much lower rates of meat, much lower rates of even protein intake maybe in the second diet, but that the biggest distinction, I guess, is really emphasis on low salt in the first diet
And this is saturated fat.
and more on saturated fat.
Yeah. This one, yeah, this one very much looked at fat and cholesterol.
Right.
And the other one definitely focused in on salt and didn't really concentrate as much on the other.
What I was surprised you didn't mention the word egg at all in this whole section. I would have thought that, because dietary cholesterol is a part of obviously eggs, and I didn't know that was a.
And an egg, and then I got to remember now, one egg has about a little over 200, correct? Is that correct?
Right.
Cholesterol?
I don't remember that, but if
I
that's the
think
case, that would be prohibited because they're saying 200 per day here.
Yeah,
Okay.
so I thought it was like 220 in one egg, I thought. I'd have to look that back up again.
Okay.
But yes, right, that's a commonly referred to. Cheese or eggs are the two most commonly referred to sources of dietary cholesterol.
Okay.
So one slice of cheese in a day, and that's it.
Okay.
So.
All right. So push on.
All
What's
right,
number
next.
3?
Number 3 is something called the Mayo Clinic diet.
Okay.
So needless to say, it came from the Mayo Clinic out in Minnesota, and it's really looking to lose weight. And it was developed by the Mayo Clinic scientists. There's a lot of science behind it, and their claim is that you will shed 6 to 10 pounds in 2 weeks, and then continue to lose 1 to 2 pounds weekly until you've hit your weight goal. So that sounds great. And how does it get done? What's the theory? And what they want you to do is to recalibrate your eating habits, essentially, getting rid of the old bad habits and replacing them with good ones. And I guess that's always the case with any diet. You're trying to get rid of your bad habits and put good habits in there. And the way they break it down is that they have a 2-part approach here. The first phase is called the lose it phase, and the second phase is called the live it phase. So part 1, the lose it phase, focuses on 15 key habits, ones to add and ones to ditch. And I don't have all of them listed, but they go through these 15, and you spend the first 2 weeks doing that, ditching the bad habits and acquiring the good habits. You're not counting calories at all during this at all, and you can snack all you want on a fruit or vegetable. It doesn't have to just that whenever you want to eat them, just eat them. It doesn't count towards anything. The step 2 part of it, when you begin that, that's where you learn how many calories you should eat to either lose or maintain weight, and where those calories should come from within the context of having ditched a bunch of your bad habits already. And it's pretty clear from their research, now it's all done by Mayo Clinic researchers as it is, but that you will lose weight in this strategy. Does it have cardiovascular benefits? The thought is that yes, it does as well, that it's thought to lower cholesterol, your bad cholesterol, and perhaps raise your good cholesterol. It's not clear whether it truly prevents diabetes, but if you are achieving weight loss, then that is one step towards avoiding diabetes, certainly. So in that regard, I guess you could say it does. And again, this diet does not leave you short on any dietary nutrients or anything like that. You're not short. Now, some other diets, which we're not going to get into, some of the more extreme diets, you fall short on certain things, and you require supplements and whatnot. But none of these diets that we're talking about really fall you short on anything.
So what would you say the biggest change from most, common diets that people would have to change if they decide to adopt the Mayo Clinic diet? I guess I was following that, but I wasn't really sure. Again, I'm just trying to understand the themes here. First one, you mentioned DASH, particularly low salt, focusing on blood pressure control. Second one, the TLC diet, focused on primarily removing saturated fats, which are anything from that walks on 4 legs.
Yeah.
And then the third one is the Mayo Clinic diet, but I'm not sure what the main change is. You said there was a list, but what are some of them?
Yeah, I mean, they're all kind of the same, to be honest with you. And this is going to be a recurring theme. So Fruits and vegetables, go crazy. Eat as many fruits and vegetables as you want. Whole grains, nuts, beans, sensible dairy, meaning low-fat dairy, cutting out sweets. It's almost like a reverse pyramid of what we've seen in the past, but with sweets and red meats being at the top, minimal, rare, special occasion type of stuff, and at the base having all those other things I just referred to. So very similar to what a lot of these diets are going to refer to. And we'll talk about the Mediterranean diet next. Very similar to that. They, I think, will, they have their science behind it, which I think maybe gets them a little more clout. They push a book that costs $26 called the Mayo Clinic Diet Book. That they feel is essential reading to get this, and it's got recipes and everything. But you're asking the same question, I'm giving the same answer, that it's the same stuff over and over and over again.
Less animal products, more plant-based products.
Yeah, and also though, foods that are another thing they talk, I haven't really addressed this, is promoting satiety, or the sense that you're feeling full, so you're not prone to go run and eat more. And so people often think of foods that are high in fiber as doing that, more so than some of the carbohydrates that you might consume or what have you. So that's another part of this as well, is that you feel more, and I can anecdotally will say that I can notice a difference when I eat certain things for breakfast. I could then be hungry by 10 o'clock in the morning, versus when I eat other things, I'm perfectly content all the way to noon, 1 o'clock without a problem. And I can really notice a difference based on what I eat.
All right.
I'm sure many people can, certainly.
All right, what's next? Number 4.
All right, number 4, which again, we've talked about before, something referred to loosely as the Mediterranean diet. There's obviously not just one Mediterranean diet. Lots of countries are on the Mediterranean.
Yes.
And they, I think, perhaps have more data behind it, they being this diet, has more data behind it than perhaps any other. It's been looked at more than any other diet, I think. And it is one that really, they aim to have weight loss, heart health, brain health, cancer prevention, diabetes prevention and control of anti-inflammatory, control of inflammatory conditions, and even cancers to some degree they talk about as well. They clearly will have you lose weight on this diet, keep it off, and you will supposedly fend off lots of chronic inflammatory conditions as well. And the theory, basically, again, it's starting to become a little redundant, is very similar, that a diet that's low in red meat and sugar or saturated fat, and it's high in produce and nuts and other healthful foods. And it's interesting, there's an organization in Boston, I'm not sure if you've heard of it before, called Old Ways. Have you heard of that before?
I have not.
So Old Ways is a nonprofit food think tank based in Boston that really has embraced the Mediterranean diet. I've gone to their website. It's pretty neat. You can get lots of recipes that go right into the Mediterranean diet, and really interesting foods and tasty. And they have developed a very consumer-friendly Mediterranean diet-based food pyramid that emphasizes, again, so it's saying the same thing. I'm going to read right here. So fruits, veggies, whole grains, beans, nuts, legumes, olive oil, flavorful herbs and spices, eating fish and seafood at least a couple times a week, enjoying poultry, eggs, cheese, and yogurt in moderation, and saving sweets and red meat for special occasions, and top it off with a splash of red wine.
There you go.
Who
could argue with that?
Yeah, so that sounds pretty, that drills it right down.
It does. But as you said, it's certainly a recurring theme that we're hearing, like less red meat, less animal products.
Less sugar, less sweets.
Less sugar, less processed, more fruits and vegetables, in emphasis more than on the prior ones on fish. This is, I think, the first time you've mentioned fish of our diets.
Previously it was just a generic blanket statement of lean protein. But this definitely is a much more fish-based diet.
Since it's named after a sea.
Right. So, and even chicken they refer to as, in moderation, whereas we will fall back chicken as being the default daily meat you eat.
Right.
That's definitely not the case in the Mediterranean diet.
Okay.
And some of it's an economics thing too. I think, meat can be expensive and not as plentiful in some of these places, and fish is much more plentiful in these places, so that plays a role. So as far as weight loss goes, again, it's more based on what you factor in as your calorie goals and calorie deficits, so you can certainly do it, but the study's really meant to promote a heart-healthy lifestyle, and clearly there are benefits with regards to your cholesterol profile and diabetes prevention. There's numerous studies looking at this. There's no really known health risk for this study as well. And you do just fine for the most part, again, with all the nutrients. You're not going to be lacking in anything. There's no need for supplements. And also, actually within this is an active lifestyle as well, not just sedentary. It's key to all these, but the Mediterranean diet really promotes and talks about that as well, that active is a key component to all this. So I'll start to zip through some of these. The next one that was ranked, so we've gone through what so far? We've gone through DASH, TLC, Mediterranean, and now Weight Watchers.
Mayo Clinic, you
Oh,
mentioned.
Mayo Clinic, Mediterranean, now Weight Watchers. Weight Watchers came in next, and that's probably worth us spending a few minutes on because it's everywhere and many people are doing it. And their aim is for weight loss, no doubt about it, hence the name, Weight Watchers. And they claim that you will drop 2 pounds weekly on their diet if you adhere to it. And they feel that now there's more to dieting than just counting calories. In the past, it was purely just a calorie counting system, and that was all it was. But they've evolved a little bit, and they've developed something called the Points Plus program. They launched it a couple years ago, and what they're doing is assigning every food. They've cataloged 40,000 different foods, and they're assigning every food a points value based on its protein, carbohydrate, fat, fiber, calories, and how hard your body has to work to burn it off. So looking at food density, essentially. And so, for example, if you're wavering between a 200-calorie fruit smoothie or a 200-calorie iced coffee, based on their point system, the 200-calorie fruit smoothie would be a better choice. They're both 200 calories. In the old Weight Watchers, those would be equal.
pick 'em, yeah.
Yeah, but not anymore. They've evolved a little bit, and I think with good reason.
Okay.
And so how does the diet work? You know, you join as a member, and there's lots of different types of memberships. There's in-person monthly membership that can get costly. There's online things you can do for online support. You can pay as you go. There's lots of different ways to do it. Some people pay up front, learn it, get going at it, and then can go off on their own. And there's lots of, iPhone apps and things like that to help you track these things. So it's a very easy to do system. Most studies will suggest that the Weight Watcher system is effective. Not as much there as far as looking at heart health and diabetes prevention, other than the thought that if you're losing weight, you can hopefully avoid diabetes. But there's not much data on that front. And they don't claim to be that. They're not looking for that at all. So it's certainly easy to follow. It's everywhere. We see it everywhere. It can be a little pricier if you go that route with it. But again, it's what you make of it when you buy the foods and things like that. And they actually do recommend that you take a multivitamin, but I'm not sure what the rationale behind it is. They just have that there. They recommend you take a multivitamin. So that's the Weight Watchers diet. I guess we're running short in time, so I'll just really quickly mention one other diet, because I had never even heard of it before, which I'm almost embarrassed to say, something called the flexitarian diet. And it's kind of a neat thing. So the flexitarian is really saying you should be a vegetarian, but be flexible to eat meat every once in a while, which seems sort of in line with a lot of what we're saying here.
It's a recurrent theme.
Yeah, it's a recurrent theme, that you shouldn't be so strict and rigid, and be flexible. If you're craving a burger once a month, have it, or something like that. So it's interesting, but I do understand we're running out of time, so maybe we'll wrap this up.
Okay.
Because
So
there's other
flexitarian, or could we also call it cheater vegetarian
Yes,
diet?
you're a vegetarian until you can't take it anymore.
Exactly right.
And then you cheat and have your burger.
Well, thank you. What a fantastic review of a bunch of diets from the U.S. News and World Report Top Diets from 2012. I think what you told us was there was a bunch of recurrent themes in all these in terms of health. Less meat, less prepared processed foods, less salt, more fruits and vegetables. Exercise is a key component. Yeah. One thing you didn't mention, which I just want to put a plug in for, is that the value of sort of this, listening to this program or being thoughtful about a diet, is trying to find a diet that you can live with.
Sure.
Because I don't think, you didn't say this, but I know you know this, and I know we all agree on this, is that if you do these diets faithfully for 6 months and then go back to your old ways, you've essentially gained nothing. So I tell my patients, try to find something that you can live with, that you can actually enjoy. One diet.
That's key, actually. That's a vital thing. Yeah.
Right. Someone told me years ago that we should tell all of our patients to eat what you enjoy and stay lean. That might be the best advice. And we have some strategies here to help people try to find things that they enjoy and to stay lean. But I would say that that's the message, is that anybody can lose weight and go on a water fast for a month, but who can sustain that? Of course, you won't. Find something that you really can enjoy and live with.
Yeah, I agree. And I'll just add, it almost does it a disservice to call it a diet, because that implies a short term.
Right.
You're trying to lose pounds for something,
Right.
and it's really a lifestyle.
Right.
So, anyways.
Awesome. Well, thank you for a great review. And until next time, this is Seth Belazarian with Dr. Sunny Srivastava reviewing diets on matters of the heart. Thanks for joining us. Until next time, good night.